Good evening, ladies and gentlemen. It is my honor to be here to talk about COVID-19 in Republic of Korea. And first of all, I would like to express my congratulations on your National Day of Occupational Health. So I want to talk about in the Korean experience. Most COVID-19 prevention and strategy was presented by the former speaker, Dr. Randeep. So I just explained in what we have done in Korea. So you heard that in Korea is the one of country where the COVID-19 is relatively well controlled. So the occupational safety and health and the infection is not closely related. Most the hazard of occupational safety and health is limited in workplaces. However, infection is spread not only in workplaces to the general public. So the most infection is controlled by the Ministry of Health side, while the occupational hazard is controlled or regulated by the Ministry of Labor side. So this kind of pandemic era, the unprecedented situation, when we have this situation, is very difficult to manage at the workplaces. So in this situation, we always think about go back to principle of prevention. Everybody knows that the principle of prevention, and then as a primary prevention, the first one is not to bring the infectious source to within the workplace. That is the best way to keep the sustainability of workplaces. And secondary prevention is to detect the cases as early as possible if we can. So to prevent spreading infection to other fellow workers. So and recently we met many emerging highly contagious infectious diseases. In 2003, the SARS, and in 2009, H1N1. At the time, we solved that problem relatively easy. But in 2015, and the MERS, the Middle East Respiratory Syndrome, is mostly originate from the Middle East, and then from the camel. But in Korea is that we don't have the camel. We never expect to have the MERS in our country. So at that time, so it was really chaos in the whole society. So because we have no systemic plan for how to control the infectious the patient. So based on that experience, we after that we changes the laws and regulation and the systems and the many things. So after the 5 years later, we met in the COVID-19. So we just started to action what we practice and what we plan. So this slide is the COVID-19 new cases, the left side in the world cases, and the right side in the Korean cases. And then, of course, Korea has done several waves. Now we are facing in, we call it in the first wave. But in you can see the last year, we controlled a very low level. And then even this year, we controlled under the 500 cases. So it is very difficult to compare the country to country, but I just pick up the cases for 1 million population. So the India is a big country, and then it's very difficult to compare to India and then Korea. And I just pick up the country where the population is very close to the Korea is a country of Colombia. So you can see the case of the new cases and then deaths of the 1 million population. So what makes the difference between the Korean and other countries? And then let's go back to MERS 2015. And the first case came out in the May 20th. And then the second case came out in the one week later. So we at the time we didn't realize what this disease is. So even the medical professional, they don't know about the MERS. Even when we met the first cases, nobody knows about the MERS at the time. So we have the 186 cases, but then it showed high fatality rate is around 20%. Is a really chaos. So and also the infection was transferred for primary and secondary, tertiary, even first transmission. At the time, 16,000 persons were isolated for almost 2 weeks. And also, if we look at the health workers, the 21% among total cases were healthcare workers. So it was really the problem at the time. So, but at the time, even government didn't know where, and then they didn't release what's going on. The people just curious about what's going on. And one media in the Korea broadcasting system, they draw the map. If we hit this, they just checked in how the case was transmitted, and then if we go enlarge the map, we can track how the case was moved. And also they draw the spreading route, and then if we hit this, and then they just follow the case. This is the index case, and then this case was transmitted to others, and then to others like this. You can easily access in this one too. So what was problem? What issues we learned at the time? At the time, it was impossible to track the infection source because we have a strong Privacy Protection Act. And also the hospital, because they have no experience. So they respond improperly. So infectious patients were just mixed at the emergency room. And the culture of the Koreans, and they prefer to visit in hospital to wish their relative here when they admitted, or for risk of communication between the government and then the public. So and after that, we changed something, and we amended in Infectious Disease Control and Prevention Act. So now we could track the record of mobile phones or the credit card in case of the special situation. So we can track the person who were contact with the case, and also develop the test quickly, and then test massively in private laboratory. And also if the person, especially in informal sectors, workers, if they hide themselves, even they got the COVID-19, it's very difficult to protect the workers. So in that case, in the medical expense is fully covered by government, even foreign visitors. And also the subsidized for isolation, minimum subside, I think $50 per day is provided by the government for isolated person. And also virtual training in a hospital was regularly performed. So when they have the unknown, highly contagious suspected infectious disease came to the hospital, they were separated and they immediately they check, and then they transfer to the negative pressure room anyway. So this practical training has been done regularly. So now we met in COVID-19. And then Korea was the first country outside of China to have the COVID-19. It was in January 20. And then one month later, we have the outbreak from regional area from the Orthodox Church. So this is the slide written in Korean, but you can guess this is the first slide. And this is the first cases. And then when 1 month later, the many cases came out in the one local regional area. And then at the time, 53 were dead. And most the case came from the age 20s. So we have done what we practiced based on the COVID-19 MERS. So first one is social distancing. So we never lock down in the country. We do expand strong enforcing the social distancing depends on the situation. So social distancing, you can see that even this airport is my grandson. We keep in the 2 meters if possible. This is the cafeteria of the hospital. Everybody just keep the distance. So, and also we restricted unnecessary visit, or we cancel meetings or tours, and then no handshaking. Generally, the Korean do not handshaking. So we just bow each other when we meet together. And also test and trace and isolation. And if the public health center, they provide in free test. So if we go visit there, and then they took our sample, and they let us know with a couple of hours by the mobile phone. And we can also track, if we found one case, we can track the other contact person. And then all the contact person, even they are negative, they are isolated, even they are not negative, they are self-isolate in the house. If they positive but no symptoms, they are isolated in the special facilities. And the wearing mask is also important. So this is also funny thing. This is my grandson. We go outside, and this is March in the 28th. Nobody were near here, but we just wear the mask. It's really useless. However, this is just like a behavior change. Everybody wear the inside or outside, wherever they visit. This is the food market. Or this is also funny thing. And then I went to the restaurant located in Deep Forest, but I still wear the mask. And then visiting the Deep Forest and then tourist attractive place, but everybody just wear the mask. So the last January, I attended in your conference in Indian Association on Occupational Conference last January. And on the way to India, I took the Indian airplane. All the Koreans wear the mask, but the stewardess at the time, they didn't wear the mask. And so I didn't wear mask when I was in India. When I come back from India to Korea, it was the February 7 or some day. And at the time, the Indian, there's the air crew, they also wear the mask. So everybody had to wear the mask. This is the experience based on the MERS. And then so this was not, wearing the mask was not mandatory in the beginning, but everybody just wear the mask. And then also Korea produced in the very well functioning so-called KF94, the mask is equivalent to N95. So based on this approach, we can control the MERS, but in this week, we face another problem. So because in the strong Delta variant, so this week we have more than 1,000 cases, and the government enforced and then strong social distance regulation, level 4. We classified from level 1 to level 4, but now it's level 2. But in next week we will have the level 4. So this is also we can reach it in information through the media, and then if we go this, and this slide show the new cases in every day. in country. And then if I want to see then the metropolitan Seoul, we can see this one. Also, we can see the age distribution, and also, and then the stage of the social distancing. Now Seoul is the level 2, but next Monday we'll go to level 4. And also even we can see the status of the vaccination. So far we have the first 30% of Koreans got the first dose, and then 11 is the second dose. And what workplaces have done to keep this sustainability in their workplaces? As in the beginning, I already mentioned about the primary prevention and secondary prevention. It's a primary prevention, the block the infection source. When we have the COVID-19, each workplace, they have the strong regulation, all close the doors, the gate, and they just open in one gate and then check everybody if they have symptoms or signs, if they visit in China or where. We try to find in the possible cases. So after that, we immediately adopt in sonography. And this is the entrance of my hospital of the beginning. Everybody was checked in their, they were asked in where they visit, and if they have the symptoms, a fever or some respiratory symptoms. Even we checked in their temperature. And this is the market. I checked the thermometer. I checked my temperature. They said my temperature is under 37 or something like that. So all the information for visiting abroad is also provided for the government. We can check easily. And also the social distancing at workplace. We try to avoid the meetings and then government recommend workplace to do work from home, or we adjusting work schedule not populated in workplaces. And also transparent plastic panel probably was placed. This is the cafeteria of the primary school. This is the cafeteria of my hospital. This is government office. So everywhere we set up in the plastic panel, not to talk each other when we eat when we eat food. Also, personal hygiene also very important. With the disinfectant is everywhere. Whenever we touch in the other thing, we usually use in the disinfectant. This is the member of the national parliament, and they just when they touch something, they just use in the disinfectant. Also, the wearing mask and the ventilation is recommended. Every 2 hours, we are recommended to ventilation. So in the summer, we just sometimes open the window and for ventilation, and also we have to use in the air conditioner. So if air conditioner just circulate there's inside. So at the time sometimes we open the window and use the air conditioner. Or secondary prevention, we try to detect as early possible. We recommend the workers, if they have developed the symptoms, a fever and the respiratory symptom, just stay at home and then do not come to the workplaces, and then just go to the public health center and then check the PCR. And then if they are negative, just they can come to workplace. So when they developed the fever during the work, and they were requested report their supervisor immediately and go directly to home using personal car, not to use the public transportation, and then go to the public center to check the PCR. So if they are suspect, and then they were isolated for 14 days, so they are not allowed to go outside, just stay here at home, and then food is supplied from the outside, from the person from the outside. So also, based on our MERS experience, the protection of the health workers is very, very important. So from the beginning, we tried to reduce the infection to healthcare workers. So this is based on our effort. And as of the April last year, and the only healthcare workers, the 2.4 were positive. So I mean the 2.4 the 2.4% of the positive cases were health workers. It's relatively very low. Even only 1% they were infected during their work. So the other 1.4% they were infected at the community. So if we go, if we see the proportion of health workers among the infected case, in SARS and the MERS and the COVID-19, in SARS, mostly health workers infected in 44 to 60%. And the MERS in the Saudi Arabia and Korea also around in the 20% were health workers. In COVID-19, in Korea was less than 1%, but in many Italy or European country, the health workers occupied in around the 10% or the more than 10%. So in summary, and then our Korean strategy for keep sustainability and enterprise in pandemic situation. First one is block the infectious source at the gate. So that is very important to protect them. Also, of course, and we recommend the employees not to visit in the public place during the holiday or the weekend, and just stay, if they possible, just stay at home and not to meet another person. We recommend them. And also social distancing, even in workplaces. Some workplaces very populated. At that time, we recommend to work from home, or some, if not possible, we install the plastic panel to protect each other. And also personal hygiene and mask is important. So wearing a mask during work is mandatory at workplaces to prevent spreading COVID-19. So it is really very, very difficult to wearing mask all the day, even the kid. So, but now it's very customized, and everybody wear the mask very well. And one more thing is the hospital, the patient control is very important. So if the patient, like who is possibly infected by COVID-19, is mixed with other patient, it is very easy to spread in infection to other the person. So and an entrance of the hospital, if they have fever or respiratory symptom, they go separate way. So they check in the temperature and then take PCR immediately and check if they are not infected, they go to a normal way. And if they were infected, they go directly to the negative pressure room. So this can keep the healthcare workers be safe, and then they can treat and prevent the infected patient. So this is my talk for Korean experience. Thank you very much for your attention.